This video will cover assessing a patient's radial pulse. To do that, you'll first begin by verifying the doctor's orders and performing hand hygiene, which I have done. You're going to make sure the patient has privacy, introduce yourself to the patient, and identify them via two methods. And then you're going to put on gloves if necessary and position the patient correctly. If you wanted to have them laying down in a supine position, you would either extend the arm or bring it across their upper abdomen or lower chest. This patient is sitting up, and so the correct position for him to be in is sitting up with his feet flat on the floor, upright, and you're going to have his arm at chest level, and you're going to have it a bit bent. You'll test a couple angles to make sure that you can feel the pulse as strong as possible. You're going to assess the patient for anything that might interfere with their pulse, whether they've taken caffeine or medications or smoked a cigarette in the last 30 minutes. And as long as they don't know anything that might compromise the integrity of the test, then you're free to go ahead. So first you're going to palpate the artery. In a radial pulse assessment, you're going to palpate for the radial artery, which is on the side of the thumb. And you're going to palpate with the first two or three fingers because your thumb has a pulse, and so it would interfere. So I'm going to palpate until I find a good strong pulse, and then I'm going to press down until the pulse is obliterated, and then let up until I can feel it as strong as possible. So I'm going to assess for the strength of the pulse. This patient's pulse is strong, almost bounding. And then after assessing for the pulse, I'll assess for the rate and regularity of it. The rate, rhythm, and regularity. So I'll watch my watch, and once I come to an even point from which to count, I'll count for 30 seconds, the pulse, and then multiply that by 2 to get the heart rate. And so starting now. So I counted 40, and if you multiply that by 2, you'll get 80 beats per minute, which is this patient's heart rate. And you'll perform hand hygiene again, and you'll compare the measurement that you just got with the patient's baseline. You're going to clean up the area, position them comfortably, and make sure that they know how to use the call light. You'll discuss the findings with them if necessary, and then document it